Hello, I'm Darren Hemmel. I'd like to introduce you to some modern research on meditation practices. This is Meditation Practices for Health, the state of the research done by the Agency for Healthcare Research and Quality, U.S. Department of Health and Human Services. This huge meta-study was done on all of the extant research on meditation, and they included mantra, mindfulness, yoga, tai chi, and qigong. So it's pretty extensive here. This is pretty much everything ever done, and it was a big disappointment when I finally, cause I read everything and I liked it, and since I'm into meditation, I kind of wanted to succeed, and I actually started college in 2012, and just to study meditation, and the conclusion was pretty sad of this is this here. The field of research on meditation techniques and their therapeutic applications has been clouded by confusion over what constitutes meditation and by a lack of methodological rigor in much of the research. It pretty much stated that there is really no good research done yet on meditation because the methodologies, the definitions, people haven't even defined meditation. There's big infighting right now, and probably for the last 20 years, on just a definition of what meditation actually is. There's the TM people, Transcendental Meditation people, who actually have their own university, and they've flooded the field, unfortunately, with their biases and their research, which is really unfortunate because at least they've got the correct view of meditation. Most people go for mindfulness and for stress relief, or better health, when for 4,000 years, 5,000 years, meditation has been practiced for enlightenment, immortality, and a bunch of cooler things and better things and more important things than just stress relief. And people are meditating for 20 minutes a day, and I think that minimum is 27 minutes a day. Actually, the research has shown that that's what causes a change in the brain. And but it's just stress relief research, and there's nothing really been done on the deeper aspects of meditation practice, which is really what I want to do when I finally get to grad school. I'm probably a year away from that. So I just want to introduce you to this. It's a good read anyway. It really gives you a pretty big overview of the modern state of research into meditation. Once again, it's Meditation Practices for Health, State of Research. Prepared for Agency for Healthcare Research and Quality, U.S. Department of Health and Human Services, and it covers mantra, mindfulness, yoga, tai chi, and qigong. It's pretty good for what it is. Just too bad about the conclusions, and that, it's just study is new, I guess. Anyway, have a great night, and happy research.